quality and timely health services is one of the key pillars in the realization of Vision 2030 for the country, with many of the devolved governments living up to the billing in making health an exponentially developed sector. Comparatively, more people have an improved access to quality and timely health services since the inception of devolution. Health being one of the integral devolved functions has made tremendous strides that have been life-changing to the citizenry. The county government of Murang'a has improved access to quality health services in the county. The renal unit, which has a team of 15 health workers comprising of nurses, doctors, psychologists and nutritionists, attend to 8 dialysis patients on a daily basis.
If you have to consider the cost implications of the patient traveling all the way to Nairobi, and that is basically Kenyatta National Hospital, then you would see that the cost is is highly reduced for the patient. On the other hand, when we refer a patient to go to, say, like Kenyatta or Nairobi for that matter, they end up spending much more time at home trying to get the resources to go to Nairobi. So by the time they go there, already the complications have set in.
The neighboring Nyeri County has invested in health with a special focus on the imaging department, which plays a critical role in rendering diagnostic services to patients living in the county and other neighboring counties. Health sector has been boosted through the acquisition of complex modern medical equipment and a fully functional comprehensive renal and dialysis unit.
This is revolutionary in the sense that we have saved our community or our people from going to look for this service in Nairobi or further places. I would say that before we had this equipment, people would come to our facility and then they would be referred to go and look for the same service elsewhere. Now that we have it here, we don't need to refer anybody outside our hospital for the same.
Likewise, Nyandarua County Government has made tremendous strides in improving access to quality healthcare in the county. Originally, health centers lacked basics including equipment, medicine and transport. In a span of 3 years, the county government has spent at least 1.2 billion shillings in upgrade of equipment in hospitals. The county government has absorbed a total of 118 members of staff in health institutions who were originally under the Economic Stimulus Program ESP. Additionally, another 124 health workers have been hired and posted across health centers and dispensaries in the county.
Nyandarua district then had Nyahururu Hospital as their district hospital. So much of the investments were done at Nyahururu. And this was left to operate as a sub-district hospital without much investments coming in. But upon devolution, Nyahururu Hospital went to Laikipia, and the only hospital which Nyandarua was left with was JM Hospital. And we did not have much of an option to just have this hospital upgraded into hospital which would be of the standard of the referral hospital for the county.
In facilitating maternal health, the county government of Nairobi has supported 2 completely equipped maternal health facilities in Nairobi. Pumwani Maternal Hospital presently has an upgraded biochemistry lab with modern biochemistry analyzer and 2 fridges for blood products. The number of clinicians has also increased from an initial 7 to 25 upon inception of the devolved units.
We didn't have this block, and then we didn't have the current modern facilities that you've seen inside. But right now, with the devolution, we got the new facilities, the new equipment, the standards that we have. You can actually compare them with the private hospitals.
Turkana County, which is largely a pastoralist area, has also refurbished the health sector to ease access to quality health services in a timely fashion. Lodwar Referral Hospital, which handles a significant percentage of medical cases, is now equipped with a modern MRI machine, physiotherapy complemented with a gymnasium and 14 ambulances, up from the initial 2. These have had a major impact in the county, with a commendable reduction in mortality rate and better health standards, which is envisioned to spur economic development in an area where oil was recently discovered. The county has also increased human resource in the health sector, with doctors at the referral hospital standing at an impressive 43, up from the initial 3.
This treadmill has done a lot for our patients, stroke patients. This is here where they train how to cope up with their hemiplegic conditions, paraplegic conditions. They start walking, training themselves how they will walk, go to the public, despite of their status of rehabilitation.
The county government of Nyamira has not only enhanced partnerships with development partners, but has also embraced technology in the rural areas. One great indicator is the use of telemedicine technology in Nyamira County Referral Hospital.
So basically what we mean by telemedicine is bridging the gap between the doctor and the patient, that is the gap of distance, time and money, by bringing the doctor closer to the patient. Like for example, here we have a patient, his name is Nicholas, and we have a doctor on the other side in Nairobi. Hi, Daktari.
Hello, Marilyn, how are you?
Yes. So our doctor is called Dr. Dare. He's here to diagnose our patient. Our patient has an ear problem. So we are here to present the case to the doctor and see what diagnosis is going to make for us.
So this is an ideal technology, telemedicine technology for hospitals that are in remote areas. We are very ready to partner with other counties, and we are actually welcoming them to be able to just carry out a program with them, as we have done successfully so with Nyamira.
Kisii County has installed brand new CT scan equipment, MRI machine, a fully equipped and functional general imaging system and renal dialysis machines. The county has also equipped sub-county hospitals with basic diagnostic machines like ultrasound and lab machines, so as to offload the Kisii Teaching and Referral Hospital in the wake of many machines acquired. Additionally, the county has increased the human resource to enhance service provision. Nyamache Sub-County Hospital had only 1 medical doctor, but now has 5. The county government has employed 69 new staff, with 39 being stationed at the Nyamache Sub-County Hospital, which is 27 kilometers from Kisii town and has a functioning operating theatre, which has seen 43 caesarean section operations take place in a record 6 months, and a very effective ambulance response system. Immunization at the sub-county stands at 71%.
Because the advantages and the disadvantages, if we can quote a few, advantages are more than disadvantages, because walking all the way to Nairobi, you don't know anybody there, and you're looking for services which now are at your home grassroots. It is something very, very, very interesting, and we're very happy about it.
Cancer has become a threat to many citizens' health and financial well-being. Meru County government seems to have a good grasp of this fact and the needs of the residents. Therefore, it has given priority to cancer detection and management. Meru County government has taken the task of sensitizing the residents on the importance of screening. Consequently, the county government has installed a fully fledged cancer screening unit at a cost of 9.7 million shillings.
This machine, we are able to run data tests simultaneously, although the capacity itself which it can learn 100 per day. As the patient continues on medication, we monitor the liver function test, the renal function test, and also the whole blood parameters.
Through its sensitization campaign in social gatherings, in just 2 months, the county has already been able to screen 305 patients, out of which 35 have been confirmed to have cancer, and are receiving interventions in various forms like anti-cancer drugs, surgical interventions, or chemotherapy, depending on the stage of the disease.
We started with 5 patients when we started in April 2015, and currently we have 200 patients.
At Jaramogi Oginga Odinga Teaching and Referral Hospital, the Kisumu County Government has ensured enough bed capacity at renal dialysis unit. It had 12 beds and machines, but now has 17. At the critical care unit, there are 7 new fully equipped beds.
When we want to give a quality service to that patient on that sick bed of the intensive care, because it's called intensive care nursing, you have to have 1 nurse against 1 patient. So if it could be possible that the government could look into it, that they employ more staffs, apart from employing, they should be those who are intensive care trained nurses.
Bomet. The county has not only given a facelift to Longisa Referral Hospital, it has also equipped it with the latest medical equipment in the renal dialysis unit, X-ray machines, latest cancer screening equipment, digital OPG room, and oxygen generating machine with the capability of generating about 10 cubic meters of oxygen per hour. All these have seen an increase in numbers of citizens seeking services at the hospital. The outpatient program has seen an upsurge from 150 to 600 patients per day. The inpatient program has increased from 40 patients to 160 patients. Devolution has had unprecedented impact on the health sector in Lamu County. On each financial year, health gets between 27 to 32% of the county budget, with the results evidenced by the tremendous strides in Kingford, Mpeketoni and Faza hospitals. Patients can now access maternity services, radiology services, theatre services and drugs.
Zamani ilikuwa tuna huduma mzuri sana. Ni hivyo hivyo tu. Zifaa pia ilikuwa ni mambo ya kuvutana tu. Ni hivyo hivyo kuriziki tu. Vileni. Lakini sasa hii twashukuru sana. Twapata huduma, tuangaliwa vizuri. Tulivyokuwa zamani na sasa tuko tofauti. Matibabu yako, dawa unapatia, tunaangaliwa vile ambao watu ambao watibiwa na sisi tuangaliwa vizuri sana.
Mombasa County. The county, in its efforts to make monumental improvement in the pivotal sector of health, has lived up to the billing in ensuring its residents are accorded quality, affordable services. 5 newly refurbished wards, a fully equipped open heart surgery section, and 13 modern renal unit machines are just but examples of the monumental strides made by the county health sector. Residents have more reason to smile as 5 more sub-county hospitals are in the process of being constructed in areas including Kisauni, Shikadabu, Likoni and Mtongwe.
Is the open heart surgery. 2 open heart surgeries have been done in this hospital, and equipments in the ICU and theatre. Some were donated and some bought by the county through the FIF.
Like fellow counties that have invested heavily in health, Kitui has not been left behind in its push to ease access to quality healthcare. Mwingi Level 4 Hospital has been upgraded by the county government from an initial Level 3. Through partnership with a number of stakeholders, the county has a functional maternity ward, a new morgue and a number of incubators. The county government has also started a KMTC from scratch to allow more training of medical students who will ultimately serve in the county and beyond. For a county that is predominantly pastoralist, access to quality health services came top on the priority list for the county government of Marsabit. Kalachi Health Centre, which was initially a small dispensary, has been upgraded to a fully fledged hospital. It is finally a relief for residents who live in the far-flung area in North Hor. They can access medical care which was initially a tough ordeal for them.
People used to go to Marsabit, Boamba Hospital, which is 400 kilometers from here, Meru, Nairobi, and we lose so many emergency cases on the way. Before this hospital, it used to be 30 patients per month, 100 patients per month, but now we are hitting 800, between 750 to 800 patients per month.